Hey guys, welcome back to Sunrise on the Hill. Health Secretary Robert F. Kennedy Jr. was back on the Hill yesterday attempting to avoid third rails. And even though he tried keeping the narrative on personal wins like new dietary guidelines, he couldn't.
Yeah, the HHS secretary definitely playing defense while being questioned by Democratic lawmakers. They grilled him on everything from vaccine rollbacks to budget cuts and leadership shakeups, decisions that could backfire on Republicans come November. Here to give us insight into the hearings is Dr. Anahita Dua, surgeon and founder of Healthcare for Action. Thank you so much for joining us again this morning, Doctor. So the secretary up on the Hill to talk about his 2027 budget. But of course, in these hearings, we always tend to go back to talk about some of the decisions that he has made. Just overall, how did you think the HHS secretary did? And did you have any questions that maybe weren't asked of the secretary that you would have loved to have heard?
I think he did as well as he could under those circumstances, which is basically a circus. You know, of course, he's going up there to talk about budget, but what we forget is that the budget has real implications in terms of public health and people. So it makes complete sense that the Democrats would try to ask him about some of those decisions, because now as he makes another budgetary cut of 12% and wants to move forward with new decisions, there's a concern that he's just going to be further decisive. And that decisive idea is basically making things look very divisive for the country, because right now he's extremely polarizing. If I was going to speak to him, I would say to him, what have you learned? That would be the number one question, because I think RFK, who's not a physician, went into this job thinking that it was going to be a lot like being on TV. You through sound bites out there. You can say anything you want to say confidently. And if you deliver the message properly, actually with your mouth, it somehow is true. And that's clearly not been the case with vaccines, with measles. There's accountability here. He's polarized the entire medical community. And so what I'd say to him is, look, going forward, what are you going to change? And I didn't see that in the way that he was communicating with the Democrats during the Hill performance.
Well, here's one thing that would change, and we just talked about it, and that's money. And I'd like to go back to that. The administration's proposing a $16 billion cut to HHS, roughly 12.5% of its budget, $5 billion being excised from NIH. What would this cut impact? And how would you see that manifesting across the country?
Well, HHS really is all about preventative health. So this situation really would impact what's coming down the pike in terms of the patients that are going to get sick. And in terms of the NIH cuts, what we're going to see is a number of people that basically could go out there and solve problems for our country, not being able to do that either because they're not funded or because their research itself is not funded. So the problem about this is that it's the silent killer. I cannot show you, hey, this is the patient that is going to die because this is the cut that's happening. But as doctors, we can clearly draw that parallel. For example, if you have a cut to the NIH budget that specifically is studying Alzheimer's, let's say, okay, and now that researcher decides I'm going to go into pharma or I'm not going to be a researcher at all, that drug that was going to be invented never comes down the pike, and it was going to hit potentially the market in 20 years, let's say. And that patient now who's going to get Alzheimer's between today and the 20-year mark is not going to be able to get the care that he or she needs. And so that's the kind of ripple effect that we know as public health defenders. And unfortunately, RFK doesn't know as a person who is not a medicine person. All they see is right now, what can I do? Almost like an animal reaction versus a really reviewed reaction about the unintended consequences.
So Health Secretary Robert F. Kennedy Jr. says he's not happy about the cuts. The president's not happy about the cuts, but there's a $39 trillion debt, so we need to cut. We talked about how these are supposed to be forward-looking hearings talking about the budget, but folks tend to go back. But one instance we saw was an exchange about measles, which is very much a current problem. Here's Rep. Linda Sanchez, a Democrat from California, getting into it with RFK Jr. about the measles outbreak.
There's a global measles epidemic. We've done better in preventing it than any country in the world.
There is no country that has seen a bigger percentage increase.
That's not true. Mexico has 3 times our measles, and they have 1/8 of our population.
Dr. Dua, what do you make about how HHS, Robert F. Kennedy Jr., has handled this measles outbreak, and could these potential cuts next year impact treating this issue right now?
He's handled it horribly, horribly. basically, comparing us to Mexico or comparing us to other countries is not the way to talk, because essentially we had eradicated it in this country basically by January. And now we've seen the biggest resurgence since the turn of the century, which is absurd. And he knows that, which is why he's been responding to questions by trying to divert the conversation and steer it away from vaccine discussions, because he knows that he's made a mistake. He even said during the hearing that there was a patient down in Texas that potentially could have been saved if he had been vaccinated. So I think that he very much recognizes that and was just in contention when speaking to that representative. And so overall, I think the entire medical community and even the Republicans seem to agree that he's handled it very badly. And so at this point, I think he really needs to bring back the conversation to the middle. And unfortunately, he's put himself in a conundrum because a lot of his platform has been about speculation and skepticism around vaccines. And so now he's trying to run away from that story and is simply unable to do that. With the budget cuts now, we're going to see an even bigger problem because he has eroded trust in our medical community, which means that there is a number of parents out there that are scared now to go to the doctor. They're scared now to follow CDC guidelines because they're not sure. So now we have to do an investment of money, if anything, to try to win back that trust and show again that our institutions are really something that we should be, standing on and believing in. And that's going to take more money. And it's interesting that they talk about, well, there's a deficit. Yes. If you have a deficit in your house of money, you don't cut the roof over your house and the food for luxury items. What I mean by that is right now we somehow found billions of dollars a day to go to war with another country that, we didn't have before, but we don't have enough money to prevent children from getting measles. Ridiculous and complete nonsense.
To the point you were making about how long he had been a vaccine skeptic and really used a bullhorn to tell people about that, and it really had traction. Take a look at this. A new Politico poll shows more Americans are skeptics of vaccine science. The poll from Politico shows 46% of people said they believe the facts on vaccines are up for debate and that it's damaging to enforce their intake. That's compared to 39% who said science on vaccines is clear and it's damaging to question it. Another 15% said they don't believe in either of those stances. So you're talking about what it's going to take to regain public trust when it comes to vaccines and a whole lot of issues surrounding healthcare. As someone who's trying to get more doctors onto Capitol Hill and have lawmakers better understand medicine, what's your message to them?
I have one big message. It is not us versus them. I recognize that sells on podcasts and that sells in the Trump administration because there's a lot of that narrative. The way that the entire administration and RFK specifically has been functioning is he does use that bullhorn, as you said, to point out real frustrations that real Americans have. For example, about the fact that we are more unhealthy. There are issues in our community in terms of being able to deliver health to our population. But pointing out these frustrations that anyone can do. You could stop a middle schooler tomorrow and ask them, hey, what's wrong with the health system? And they'll be able to say the same things RFK is saying. That's not the job of the HHS secretary. Everybody knows that. The job is to say, okay, what's the execution? How are you going to fix it? And he has been completely unable to do that. And so what he's done instead is said the medical community is bad. There is a them and there is an us, the good people, the good guys that are trying to help you. And that is creating a lot of discord in our patients, in our population, and unfortunately now resulting in the poll that you just showed where people are becoming more and more skeptical and distrusting of the medical community. So I would say stop doing that. You don't have to do that. The medical community will support you if you're doing the right things and will actually push your own message forward. And ultimately, everyone will win, most importantly, the patients.
All right, we'll have to leave it there. Dr. Anahita Dua of Healthcare for Action and Surgeon, we appreciate your time and insight as always. And we'll see you next time. Enjoy
Always
your weekend.
Great to have you. Thanks so much.
Thank you so much.
We're going to talk a little bit more about our